Erica, welcome back.
Thank you. I'm excited to be back.
Thanks for coming back on.
Yeah.
You, this business is wild because you get into like a little groove of, okay, here's my niche and here's who I'm talking to. And then we got together and it was just magical. It was great. And like I said, you're an annuity for me. Like it's just the people keep coming back on and it keeps getting likes and shares and comments. I got a comment, I think, yesterday on something either on TikTok or on Instagram. And this was over 6 months ago.
Mm-hmm. That's awesome.
So, yeah. Well, and you're just the smartest person in the room, I think, who is a public face for nurses, for nurses and advocating for nurses' rights on a national level.
Thank you.
You're welcome. I think that there's just no one better than you, than what's going on, because the thing I love about you is you bring it, like you've got the biggest dick in the room. And also, you're not afraid to go in the comments and clap back at people that are misinformed or jaded.
Yeah.
Right?
Absolutely.
And so you stand by what you believe in.
I do.
This isn't just for show and for like clickbait. And so I love that about you.
Thank you.
You're welcome. And we become friends, which is a bonus.
Yeah.
You know, that now like you and Brandon had dinner together. It was awesome, which we have to do again.
Yes.
It was just you're a good person. And you have, I've always done this with a few other people, but that seat is open for you literally whenever you have something to talk about, get off your chest, let people know about it. Let me know and we will get you in here.
Okay.
Okay.
Yeah.
All right. Let's begin. Why are nurses forced to work while sick and who benefits from that insanity? What happens when you're treating cancer patients or ICU patients while you're contagious?
Well, oncology patients have virtually no immune system to fight anything off, right? So their nurse should be what we call a clean nurse that doesn't have any quote unquote dirty patients, which are infectious patients, because, you don't want to spread that to them, of course. But they will, and they being management for staffing purposes, will completely disregard best practice and say, oh, if you just wash your hands properly in between patients, it's not an issue. Are you not do you not think that you can wash your hands appropriately? It's the victim blaming all the time. But they will force us to work sick. There are extremely punitive attendance policies that are pervasive throughout the nursing profession with various organizations. So you may only have 3 call-in days, sick days per year. Yeah, there's a lot of places. It's that stringent. Yeah. Or you don't even get sick days. They give you your PTO days, but it's combined with your time off. And so if you are nearing that point, they will threaten you. They will write you up. They will give you disciplinary action. And so the result is nurses are forced to come to work sick, which, first of all, imagine how difficult that is for the nurse, because these are grueling 12-hour shifts on your feet, no break, right? But for the patients that are often immunocompromised or susceptible to all manner of hospital-acquired infections, we are putting them at risk. It's terrible.
Take out being sick. What about the single mom who's a nurse and
that's me.
Child is sick.
Yeah.
Child has a doctor's appointment. Child has the myriad of things that we're both parents that kids have. And you have only a finite amount of PTO, sick days, whatever. So then what do? Take an unpaid day off to get stuff, to take care of your child?
They don't even often give you that opportunity. It's truly, it's you have this amount of days. And there are a lot of places now are going to a crazy point system. So it's this cumulative effect where if you're tardy 1 minute, you get this many points. If you miss a day, you get this many points. If you are, written up for something completely opposite, this many points. And so once you reach the threshold of 15 points or whatever it is, they terminate you. They term you. But that is something I struggled with for years because I was a single mom working bedside for years and years. And they give zero fucks, like sub-zero fucks about what's going on in your personal life. It is just so black and white with management and healthcare. And they don't care that they'll get rid of a nurse that maybe has worked there 15 years, that is a huge resource to everyone else. They don't care.
Is the rationale from management and the administration that they have a laundry list of people, a queue of people that they can hire, and that's better?
Not exactly, because they don't really want to hire anyone. That's the dirty little secret, right? I told you before, there's no nursing shortage, right? There's tons and tons of nurses to fill all the vacancies. But there's a component of we can hire and replace you for cheaper with a new grad for much less money. But there's also a component of maybe we'll just let that vacancy sit there for a few months
and see what happens.
And gaslight the staff and breadcrumb them and say, oh, well, we've got the position listed. We're interviewing. Meanwhile, all of our friends have been applying that we know are qualified, and they're not even getting a call back. They purposely will leave positions vacant and short staff to increase their profits.
Wow.
It's a business model.
Who are the biggest culprits? And again, I don't want to get you in trouble. So if you're like, you don't want to say, it's fine, but like being married to a nurse, and I don't want things to come back onto her because I love her and I enjoy having sex with her, and I don't know if she enjoys it back, but I enjoy it. So I never want to rock the boat with her, but she's mentioned certain healthcare companies that always come up.
Yeah. HCA is probably allegedly the biggest offender. Any major healthcare organization, they all do this.
All of them.
The small ones, the big ones. Yeah, they all do.
They're all guilty.
They all are. Yeah.
Okay. How does it make sense that boards of nursing punish nurses for needing mental health care? Why are 30 states asking about mental illness on licensing applications, and what actually happens if you answer honestly?
Yeah. So about 30 state boards of nursing have mandatory questions when you apply for your nursing license and renew it every 2 years. Then it's a series of questions. Have you been treated for any mental health related issues in the past 2 years? If so, fill out these 10 questions. Have you sought medical treatment for this? It's a screening. The problem is that it very often triggers mandated programs and monitoring for the nurse. So it puts essentially their license in jeopardy. Okay. Now it can be something like you had a DUI 5 years ago, one time, before you even became a nurse. But now they're asking, have you ever had anything that fits into that category? Well, you have to answer yes, because a lot of the questions are ever in the past or within the past 2 years. And you have to answer, because if you lie to the board of nursing, that's it. It's over. And then that triggers a mandatory monitoring program. So they'll throw you into, like a drug, alcohol, rehab monitoring thing where you maybe just had this one incident and you're not actually a drug addict or, and then they force you to pay for drug tests at a drop of the hat, and they're expensive. And you have to do it every week.
And that's out of your pocket. You're paying for that.
Oh, yeah. And they'll call you and give you till the end of day to do it. Doesn't matter if you're at work. Like, figure it out. Yeah, they're terrible. Some states are worse than others. But essentially, it puts your license in jeopardy. And now you're being monitored, and it just doesn't go away. It never falls off. And it's a money grab. They're using it to make money off of nurses with these monitoring programs. So the end result is that nurses who know that they have depression or whatever else, maybe suicidal, thoughts, will not seek treatment. They blatantly will not seek treatment because they know that means the State Board of Nursing could very well find out, and then their license and their livelihood is put at risk. So the people that you have taking care of you in the hospital, because we're human and we have mental health issues just like everybody else, don't get the treatment that they need for it. because the state boards of nursing that are supposed to represent us often, and again, it's not every state, and some are worse than others, they often use it as a form of like retaliation almost.
Do the state boards own the monitoring systems? Like how is it a money grab?
Yeah, it's often contracted. They subcontract it to a third party.
Is there kickbacks? Do you think? Like
Probably.
That's bananas.
Probably.
I mean, it just seems like it's like this, like when you pull the drain thing out, and this like that whirlpool that gets formed, and it's just like there's this sucking of people and talent and people that care, that give a shit, that want to help, that are pleasers, and that you're fighting this like gravitational pull against you.
Yeah, that's how it feels.
In the name of a profit and loss statement.
Yeah. There's nurses that have lost their lives over this.
Really?
Oh, absolutely. And not isolated incidents. A lot that have not gotten the help that they need.
Well, they won't.
Yeah.
They're afraid to for fear of retaliation.
Yeah.
Wow.
It's terrible.
Oh. Do you believe boards of nursing are protecting patients or protecting their revenue streams? Tell me what you've seen when nurses get forced into monitoring and recovery programs. Who profits?
Not the nurse, ever. Never. There are nurses that have actually left the profession entirely because they have been put into these monitoring programs for years, and they satisfy all the requirements and they can't get out. They just keep extending it or adding on more requirements, and they're going broke. I've talked to nurses that are living in their car because they are spending so much money paying for all the mandatory testing and requirements that they can't afford to live and pay their bills in addition to that. So it's really a problem in some states.
Is it something you've talked about on your podcast, or is it something you've talked about in the content you're putting out?
Yeah, we talked about it on the podcast, yeah.
What's the feedback you're getting from your audience?
Thank you for talking about this. No one talks about this. Yeah, we need to be talking about this. We need to get out there because there's a lot of shame attached to it, right? No one wants to advertise that they maybe have a mental health concern or an addiction issue, but now they're forced to almost advertise it because like you have to inform your employer because you might get that call that says, go get a drug test by the end of the day. Well, your employer has to know why you're leaving suddenly, so now everybody knows your personal business. Yeah.
No one keeps secrets.
No.
Lord, nurses love to talk.
We do.
Yeah. Chatty Cathy's, as my mom would say. Bless your hearts,
true.
But oh my good heavens. Hey, it's a coping mechanism. I'm okay with it. Whatever. Why do so many nurses suffer in silence instead of speaking up? And what's it costing us? Is fear keeping nurses quiet? And are patients ultimately paying the price?
Yes, and yes. Fear is the motivation behind nurses not sticking up, fighting back, speaking out, because we are constantly faced with the fear. It's not even fear, it's reality. We all have seen or been the victim of nurses being retaliated against for doing the right thing, for reporting a safety concern. And then you are now blackballed, essentially. They suddenly, I need to speak to you about your performance. Your performance has been suffering. Really? How's that? It's been fine for years. So now that I reported this really unsafe condition that had nothing to do, it's because of the way the hospital is choosing to operate. Suddenly I'm a problematic employee and I'm then put on a performance improvement plan. You're under the microscope. They're pulling you in the office. They're essentially making it so miserable that you quit. And most of the time that's the outcome, which alleviates any of the responsibility from management. So they don't have to terminate you. They quit. We didn't do anything. They were a problem employee. They quit.
What are some of the most documented, glaring instances of retaliation that you know of?
I think I talked about this before when I was here. When you're the victim of an assault at work, violence at work, in the hospital, wherever, and then they ask you, what could you have done differently? And here's some mandatory health stream modules. Do this in your free time at work, which we don't have, and pretend like you're learning from it so that we can then weaponize those learning modules against you in the future and say, well, look, we provided you this education and yet you still allowed this to happen. You still put yourself between the patient and the door or whatever. You weren't following procedure all the time.
It's almost like a victim of sexual assault being accused of dressing slutty.
Yeah. What were you wearing?
Yeah, they had it coming.
Yeah.
You were asking for it.
Yeah. It's exactly like that.
How do the people at the administrative level, at multiple levels, like this is coming from, the CEO all the way on down, how do you think they live with themselves?
Oh, I think they live very well high on the hog with no concerns. They are paid very well. They have a lavish lifestyle often, at the expense of patient lives, nurses' lives. I don't think that they care. Now, there's some good ones out there, sure. But by and large, I think to operate at that level and be successful at that level, you have to sell a part of your soul. You have to sell out nurses and patients.
Well, look at the CEO of United Healthcare.
Yeah.
He's assassinated.
Yep.
And I forget the kid's name.
Luigi
is edified, by people.
They're making a musical about him.
Are they really?
I want to be there opening night. Opening night.
This is like a Mel Brooks thing. Like, this is hilarious. Are you kidding me?
Nope. Someone's making a musical about it.
Oh my God.
I think it's the best thing in the world.
Well, I'm a big fan of bringing awareness to an issue. And if this helps bring awareness to an issue, like Mazel Tov, go.
Yeah.
Do the musical.
No, I mean, no one wants to hear it, but God bless Luigi. Like, no one is condoning the violence. We all know that's wrong. But and who knows if he did it, But when you are pushed long enough, far enough, you will snap. That applies to anyone and everyone, right? We need to stop as a society constantly pushing people past their limit.
And I think that's what's happening in other areas now, like politically, like people are just losing their minds about stuff. And I mean, Luigi wasn't a nurse, was he? Like, was he even in the healthcare?
No, he had, I want to say a master's degree in like economics or something, not medical at all.
I don't know that much about the case. But
engineering, I think. Engineering.
Okay, so if he's an engineering major, master's, what prompted him to assassinate the CEO of a healthcare company?
Allegedly, he had health problems and his back had been messed up from surgery and he had insurance issues from what I've read. I'm sure it'll all come out in trial. And his mom did as well. And so I think he saw the suffering and experienced the suffering himself firsthand and really kind of tied it together to, the organizations, the big healthcare organizations.
A mess.
Yeah.
It's just a mess. And I mean, I guarantee you after that happened, every CEO of every healthcare company on the planet was hiring an Team 6 team to surround them whenever they go out in public.
Oh, yeah.
From now on.
They
and their families.
Yeah.
All have targets on their backs now.
Meanwhile, nurses are being assaulted, killed, raped at work all the time around the country. Do they provide even an extra security guard the day after someone is murdered in the hospital? No. But the CEO gets gunned down and they all have private security teams now, paid for by the organization. Yeah.
I'm baffled by that. Let's talk about the real infection, cowardice in the nursing culture.
Yeah.
You've said nurses are often afraid to speak up. How do we get their sense of justice to finally outweigh their fear?
Yeah, that's my constant everyday struggle is trying to get through to nurses. And they always have excuses and the excuses are legitimate. It's, I'm a single mom. I have bills to pay. I don't have a lot of sympathy because I have been in that position and it never stopped me from having courage and doing the right thing. And I have paid the price. I have been terminated for doing the right thing and for fighting back. But I would do it again. I have done it again. The only ones that I think maybe I can kind of understand a little bit is they live somewhere that's very rural and there really only is the one organization that you can work at in that geographical area, right? So you can't burn that bridge. But maybe you could go do home health instead or something else. I mean, that's what I would do. It's tough. It's so hard to get nurses to show up to anything, to put their name on anything, a petition, to come to a rally, because unfortunately, management is there. They have people hiding, looking, taking notes, who's there. They report back, and then you're called into the office the next time you work about your performance, like I mentioned earlier.
Yeah.
It's very retaliatory. And being blacklisted is a thing, even though that's illegal.
Wow.
Yeah.
Wow.
So then they affect your future employment.
That's insane.
The retaliation is on another level. It is leaps and bounds above any other industry.
Really?
In nursing. Yeah.
It's vindictive.
Absolutely. That's the perfect word for it. It is.
It's vindictive,
It is.
Erica.
Yeah.
I mean, I'm blessed in that my wife's a nurse. She's a hospice nurse here with Choice Hospice. Shout out Choice Hospice. Here's your pen. And the people that she works with are amazing.
Mm-hmm.
Like they have calls in the morning, they have calls in the afternoon, and she's happy. She's supported. There's really it's
rare.
It's like the needle in a haystack.
Yeah. She found the one.
She found the one.
The one.
Because and she kind of knows this when she came out from Tampa and she was a hospice nurse there.
Yeah.
And when she was coming here, I'm like, oh man, like all I've heard is just nightmare stories about the healthcare here in Las Vegas.
Yeah.
And the fact that she found a company that at least here gives a shit.
Yeah.
And supports her.
Yeah.
Is unbelievable. Because that's unheard of.
Hold on to it.
That's unheard of.
It really is.
If any of y'all are in healthcare and looking for a job, I don't know if they're hiring, but Choice Hospice in Vegas is 10 out of 10. And I know from personal experience because I want I hate the term happy wife, happy life. That's horseshit. Fuck that. I want my wife just happy in general as a human being.
Mm-hmm.
And I know that she's happy right now in her position,
Yeah.
which goes against everything we're talking about right now. So that's why I'm just like, ugh. And again, I love and trust you implicitly. So I love hearing it because it gives me better balance and just more of an objective view of what's going on a national level in healthcare.
Yeah. She's very lucky.
Because you're like, well, they're vindictive. I'm like, Jesus Christ. Her boss makes fucking these great sourdough brownies. Like, what are you talking about?
Sourdough brownies?
Oh, they're fantastic. I've
never had one of those.
She made these cinnamon buns that are like, they should be illegal. They're so fucking good. And I know where their office is, and I have I know where Brandy is. We do it for safety reasons,
location.
right?
Yeah.
And whenever I know she's at the office, if I'm driving around, I start to be like, hey, what are you doing?
Are there any brownies
what
in
are
the
you
break
doing?
room?
Is there any treats? And there's a 99.9% chance there are treats.
That's
so
amazing.
I just happen to slide in, and then they're good to me, and so I don't.
That's wonderful.
I'm never. And full disclosure, I'm never observing anything that's HIPAA related.
Of course,
that's all. Like I go in there, we say hi, cordial. I grab my treats, hang out for a little bit, and off I go.
Yeah.
But like that's the culture that she's in.
That's amazing,
right? And so there is hope. Because I assume there's pockets like that around the country.
There are pockets. There are, yeah. And California is a big one.
Okay.
Because the vast majority of nurses there are unionized. So they have that protection. And they have the mandated nurse-to-patient staffing ratios. So those nurses, I went to speak at an event there for nurses in Northern California last year. And they are amongst the highest paid nurses. They probably are the highest paid in the country. And they have the union. And so many of them have only ever worked there. I think that they often think the stuff like I talk about is exaggerated, or they can't quite wrap their head around or appreciate it. Yeah. And I'm like, you guys don't know how good you have it here. And there's always room for improvement. Yes, it still has a long ways to go. but you have it so good here compared to 80% of the nurses out there.
Let's talk Nevada.
Let's do it.
Let's talk Nevada, SB 182.
Yes.
And why should everyone care? What would nurse-to-patient ratio laws actually change in the daily lives of nurses and for patients?
Yeah, so SB 182 would establish minimum nurse-to-patient ratios, meaning the number of patients a nurse can have. This is by far the one thing, if I had to pick one thing that would change healthcare for patients and nurses, it would be mandated nurse-to-patient ratios across the board. Every year they reintroduce a federal bill, and every year it dies in the Senate. There is California. There is it Washington or Oregon just became the second state. But that's it. That's it in the country. So this bill is now pending in Nevada. It has passed the Senate Assembly, so it has gained some traction. But we really need all the residents in Nevada. I'm going to tell you, I have it written down here to go to leg.state.nv.us and click Who's My Legislator. Enter your address. You'll find your state senator, assembly member. Click on the legislator's name. You'll get their email. Email them, write them at them on social media, tweet them, send snail mail, and do it regularly and tell them they need to support and pass SB 182 because the opposition to that is outrageous. They had their first hearing a few weeks ago. When I tell you every chief nursing officer in the state showed up in opposition. The Hispanic Chamber of Commerce. Why? Why is the Hispanic Chamber of Commerce in opposition to this? I have no idea. They brought out all the guns. Now they had 2 days ago a new hearing about it. And our state senator, what is her name? Robin Titus, who is a physician. She's a physician. I believe she was an obstetrician. Stood up, opposed to it, went on a rant saying that all the hospitals are going to have to close if this gets approved, which are age-old scare tactics. That's what they said about California, and they've had the mandated ratios for 20 years. So clearly that's not the case. Claimed that it's going to be the destruction of everything. We won't be able to have like rural health care facilities, that there's no proof that it helps patient outcomes, which is absolutely not true. Study after study after study consistently shows that for each additional patient a nurse has above the recommended ratio for that specialty, all of those patients have between a 7 and 10% increased risk of death or serious complication. So if the recommended ratio is one nurse to 4 patients, and you give that nurse, let's say 6 patients, which is very common. It sometimes will be 7, 8, 9. I've seen 10. That means all 6 of those patients now have up to a 20%, because it's per each extra patient, 20% increased risk of death or serious complications. Now, I don't know about you, but I'm not okay with those odds.
Chiron uses Young for Life wellness, and now he's literally glowing. Meanwhile, my glow comes from studio lighting and desperation.
Call it wellness, Jeff.
I prefer denial. I wonder if Senator Titus, if we were to look at her publicly disclosed donation list, what healthcare companies
that's on my list
and
to look at that,
and how much what they've donated. I mean that's been a big one now. That it's Freedom of Information Act. It's there, and we can see who.
I wouldn't be surprised.
And that's something that for you down the road, if you do a clip about her, or about and this is just again because I have friends in Carson City. So full disclosure, I have friends in Carson City, and you always go back to the donor lists to see not just by company, but individuals. Yeah. If you see individuals that are putting in certain, go on LinkedIn and see what that person does.
Yeah.
cross-reference that person's name from the donor list to LinkedIn, which is the number 1 B2B social media platform on the planet. Oh, this person is, senior VP at, Fern Flanagan's, healthcare company. I think that would be a good one for you for content, because again, look back at like what's going on outside of health, well, somewhat healthcare too, but people like Bernie Sanders or Elizabeth Warren that are going at the Republicans for stuff. And again, I'm middle of the road, but I'm Republican right now because they're making changes.
Yeah. Bernie
and Warren are both coming at the Republicans about stuff where meanwhile they're getting millions of dollars from healthcare, from the healthcare companies and lobbyists and PACs are donating billions. So I wouldn't be surprised if the same thing's going on here in Nevada.
I wouldn't be surprised at all.
But just follow the money.
Always follow the money.
Follow the money.
Yeah.
And we will we'll make a clip of what you said and we'll put in the website. We'll put that link in along with what the website looks like so people know what it looks like, and then so people can go ahead and do that.
Yeah.
That's of course. Do hospitals treat nurses more like liabilities than lifesavers? Is the modern hospital system set up to discipline, threaten, and silence nurses more than support them?
Well, it's intrinsically paternalistic, right? It's a constant condescending tone in general. Nursing being a female-dominated profession, we have forever, since the dawn of the profession, historically been treated lesser than, not given a seat at the table. I'll tell you the perfect way to illustrate this. We just had Nurses Week, National Nurses Week, earlier this month. And, this is a nationally recognized thing. It's been around forever. And it used to be a nice little celebration to acknowledge nurses by the employer. It has now become a laughingstock. And the gifts, quote unquote, that they give nurses, rocks.
What?
That was a big one a couple years ago.
A rock?
A literal rock. They walked outside, got rocks. Maybe they washed them off. Maybe they didn't.
I don't mean to laugh, but
wait,
I gotta laugh.
They took paint and wrote on the rock, "You rock." That was their gift.
The only thing better than that would be bringing back like candy stripers and give them the old uniforms back.
Yeah.
We talked before about like the hats that nurses had to wear a long time ago. Like bring back candy stripers and here's a rock.
Yeah.
Like what the shit, man?
Speaking of hats, they, in addition to the just insulting gifts, for Nurses Week, they will often come up with activities for as if we have time to go do any. It's so ridiculous.
Team building activities?
Sidewalk chalk. I shit you not. And this is not isolated. A lot of places do this. Yeah, go outside. I shouldn't be laughing, but I'm laughing. Go outside and paint the sidewalk instead of treating your patients.
Fuck you, HCA.
Yeah, right? And one place this year had arts and crafts to make your own paper nurse's hat.
Oh,
like we're in kindergarten.
God.
With our little safety scissors and our glue and our red pen to do the cross.
It just shows, it's a glaring demonstration of how out of touch senior level hospital administration is with nurses.
Well, and they just don't care. Imagine doing that to a doctor during National Provider Week, Doctors Week. They would never think, here's a rock, here's some sidewalk chalk.
Picture giving a surgeon a rock and some sidewalk chalk.
Yeah.
They'd fucking kill you.
Yeah. Yeah.
They'd walk
The
out.
surgeons generate a lot of revenue. Nurses cannot bill for nursing services. And that would be a huge game changer if we could. Immediately overnight, we would be respected and treated better.
We covered the question about with Nurses Week, but that is bananas.
Yeah.
Bananas.
There was one place this year that actually there was a couple. I swear they go to the same convention every year, the same conference, and they all get together and they're like, okay, so this year, the theme for Nurses Week gifts, personal massagers.
Oh, Jesus.
I gave him vibrators. Let's be
Well,
real.
I was going to say, come on.
Let's be real.
Hey, if you're a woman and you want to double click your mouse, God bless. Have fun. Whatever relaxes you, you enjoy.
These little mini massagers.
That's hilarious.
There's about 3 places this year.
Did it have the brand of the facility on there as well?
Oh, they always have it.
Because how funny is that in terms of the ultimate dystopian novel?
Yeah.
Is that you're masturbating to with a tool that is actually the cause for you wanting to masturbate in the first place.
Right. That's a great analogy.
That's like something out of the Hunger Games.
It is.
Jesus Christ. Oh my God, Erica. Oh, HCA. Okay.
There you go.
Holy Jesus. I'm okay. We touched this a little bit, but I wanted to double click on this. You called the management style in hospitals paternalistic.
Mm-hmm.
Break that down for us. What's it look like day to day, and why doesn't the MBA mindset work in healthcare?
Well, so they take these 35-year-old without any kind of healthcare background, clinical experience that has an MBA degree, and they put them in charge, and they try to apply this business model to healthcare. It simply doesn't work. Now, you have to be financially, strong, right? You have to be able to support the business, and that has to be a concern. But their only goal is to increase the profit margin at any cost, often the cost of lives, right? So the difference is when you put someone with the clinical knowledge and experience in charge, they are approaching it from the perspective of doing it for humanity at large, for the community. But you put the little MBA graduate in charge, and they're doing it to get their bonus that year.
Unbelievable.
To impress the investors, because hospitals all employ professional investors, even the nonprofits.
Really?
Yes. That claim that they are, destitute, they're going broke.
Of course.
Yeah.
Of course they are.
They employ professional investors most of the time. They do.
We need to work on, this is off topic, but on topic. We need to have coffee sometime.
Okay.
And I want to help. Again, I like business stuff and helping stuff. That's how I'm a pleaser. And all right, how can we get you enough money to give you a national platform to just, be the megaphone, even at a larger level, because people need to know this stuff.
Yeah.
And it's obviously it's falling on deaf ears if this stuff is still going on.
I think I scare a lot of, I know I do, groups and organizations off because I am very direct. I am very blunt in my communication. I am very transparent. And that's off-putting for a lot of people. I recognize that. And so, as much as I, for example, support unions, I'm the biggest pro-union person out there, and I do anything and everything for nursing unions. They don't often reach out to me, even though I am probably one of their best resources at getting the message out, because I don't think they want to be associated with a loudmouth. I don't know.
Well, it would. I think devil's advocate. I think it portrays them as, a whistleblower, someone that's going to rock the boat.
Yeah.
And so when they're going to the table across from the administration for salary negotiations, benefits, and all that, it gives them kind of maybe one arm tied behind their back because of who they're affiliating themselves with. But desperate times, man, desperate measures. Come on, y'all.
Yeah. And, I'm keenly aware always that I only have this path in life, this kind of career that I've created for myself by accident, because nurses have been systematically abused for generations. I only have this platform because nurses have been systematically abused for generations. Think about that.
It would be nice if you worked yourself out of a job.
It would be great. I would love that.
Right?
I would love that.
I think we'd all love that for you.
I would love to go to the celebratory party after the federal legislation is passed for nurse-to-patient ratios and to make it a felony to assault a healthcare worker and say, it's my swan song. It's been great, guys. I'm out.
What do you think of at a national level, RFK Jr.? Is he going to have an impact on healthcare and the ethical and fair treatment of nurses?
For nurses, no. I mean, I don't know if you followed any of Dr. Oz's Senate appointment hearings. Did you hear what he said?
No.
So Dr. Oz said, we don't necessarily need to get more nurses in long-term care in nursing homes. What we need is more AI nurses and remote nurses. So we don't need you there in person to be a nurse, to do the nursing skills, to assess the patients. We're going to put some AI technology in there, some remote nurses that can hopefully communicate through a computer to the patient that can't probably communicate back. And so he's in support of that kind of crap,
How would AI help out a dementia patient that the AI, say it's like Tesla's making the robots now, whatever, like the AI beings.
Yeah.
Say that comes in with a little nurse's hat on.
That they made at Arts and Crafts.
That they made Arts and Crafts because they don't want to do the rock. So that instead they have that. And the AI thing comes in and sees a dementia unit, a dementia patient eating their own feces. That
happens.
I know.
Finger painting on the walls.
Yeah. Like how, like the toxicity of that in terms of the environment. Like how does an AI not break, over time with that, getting like fecal matter in your, little finger units.
They're not even hands-on in that way. They will then call the nurse that is there or the CNA, whomever, and interrupt them in whatever task they're in the middle of and tell them they need to go do something. So how is that remotely helpful?
No, it spreads that person even more thin.
Correct.
On what they're doing with their workload.
Yeah.
Now they're working with, let's say, 6 patients, which is too many.
Yep.
And then on top of that, they have an AI unit that they're also working for that's going to grab them, not knowing where they're at and what they're doing, and that they're already busy with patient care, right?
Yeah. Yeah.
Like, what the shit, Dr. Oz?
It's absolutely insane. He says, I think his argument was, well, look, they're so severely understaffed in long-term care that essentially there's nothing we can do about it. You're not going to be able to get more nurses in there because the quote-unquote nursing shortage and all of that. So the solution is AI and remote nursing and telehealth and all that. The solution is pay them appropriately and give them safe working conditions. Give them a reasonable, safe amount of patients and some basic security. And guess what? You will have all the nurses that you need. It's really not that complicated.
It's something that, again, it's basic economics for me with business plans is, what's the hospital here? Southern Hills Hospital. My son Jack was born there. And we had such an amazing experience with their labor and delivery that's where I went. I think I had my my appendix taken out there.
Okay.
And at the time, I was living in Henderson all the way across town. I drove myself because I was at that time in a not good relationship with my wife and she was off doing whatever. And so I drove myself.
Knowing you had.
I drove past St. Rose Dominican. St. Rose Dominican, I'd rather be treated by a leper colony in the Seychelles than fucking go to St. Rose Dominican to get treated for anything. And that's on me. And if you want to come after me, eat a bag of dicks because they're awful. They were awful to me. And so I drove myself all the way, a half an hour drive across town, got there. They got me. They admitted me immediately. They said, if you'd have waited one more day, your appendix would have burst.
Yeah.
You would have been done.
Yeah.
Burst, done. So I go there because we had such a good experience with labor and delivery. Now they're going to get my business whenever I'm sick.
Yeah.
And so that's like, wait a minute, provide a good service.
Right.
And you're going to get business from that.
It's pretty simple.
I don't have an MBA, Erica, but I don't wake up.
But you have common sense.
I'm not the smartest guy, in the room, but I'm not the dumbest guy either.
Right.
It's common sense.
Yeah.
And that's the part that there's a big disconnect there.
Yeah. Huge.
Right?
Huge.
Okay. I love these questions because it's questions I've come up with. A couple of them I have had to cross off because you've already answered them like wonderfully well. I love that. I fucking love your brain, man. Is it fair to say that many nurses are in an abusive relationship with their employer? Working off the clock, being written up for 15 minutes of overtime, constant threats. How is this tolerated?
Yeah, there's a lot of parallels between an abusive relationship between, say, two partners or a husband and wife, and being a nurse. It's like, I have to stay for the kids. I have to stay for the patients. Who's going to take care of the patients? There's a lot of that. They're saying that they're working on it. They're trying. They're getting better. They're going to therapy. Your manager is telling you, we just listed 2 positions. We're trying. We're gonna get you guys help. They just keep breadcrumbing you, and nothing ever changes. So there's a lot of parallels there. But yeah, it's so toxic, and I don't think people understand. So you mentioned the overtime. They will absolutely scrutinize if you have any fractional overtime. So you clock out 15 minutes later than the end of your shift. Why? Because you have too many patients, right? And it's impossible to get the work done, but they don't want to acknowledge that. So, and granted, from a facility organizational standpoint, fractional overtime adds up to millions of dollars. It does. And so you do need to be aware of it. But what they'll do is they will start micromanaging nurses, and every single day call you in the office. You're in the middle of a million things, and you get a phone call from the manager. I need to speak to you in my office in front of everybody, So it's embarrassing. And you go in, and you had 8 minutes of fractional overtime. We are going to, sometimes put you on a PIP, a performance improvement plan. We're going to be monitoring this. If this doesn't improve, you're going to have progressive discipline. You're going to be written up, whatever. And so what often happens is nurses will clock out when they need to clock out and stay and work for free off the clock, which is illegal. It's illegal. Management knows they're doing that. They know it's illegal. That's wage theft. They don't care because it's good for their bonuses if their unit doesn't have fractional overtime. It's good for the organization's profit margin. But that is how beaten into submission nurses are. Very much like victims of abuse in relationships. We are beaten down long enough that we start to do those things. I don't care. I can't get called into Kathy's office one more time. I don't care. I'm going to clock out and stay and finish my charting. And sometimes they'll stay for an hour and a half, 2 hours because they're so behind because of the workload for free. Or they're told that they have poor time management skills. That's a really common one. Really common. They gaslight the hell out of them and say, you need to work on your time management. If you had appropriate time management skills, you would be able to clock out on time. Maybe you need to come in early and look all your patients up ahead of time so that you can get through a shift change report quicker. Well, again, they're not allowed to clock in when they get there because you can't clock in till the appointed time. So they're coming in early. They're accessing medical records, electronic health records, which is actually a HIPAA violation. They should not be doing that because they're off the clock. But the manager has been encouraging that and telling them to do that. So we're working for free. We're putting ourselves in jeopardy because, like I said, HIPAA violations, wage theft, all of that, we're complacent with that. But we're so beaten down into submission and always told it's our fault. We are the victims. Poor time management. I was told I had poor time management after I'd been a nurse 15 years. Like, be for real.
Come on.
Be for real. I can do this in my sleep. It's not my time management, but that's what they do.
And is this going on everywhere? It's just an epidemic?
It's like very pervasive.
Every healthcare
pretty much
company is practicing
pretty much
time theft.
Oh, yeah. And there's been a lot of class action lawsuits. But that's another thing. Nurses are afraid to pursue the class action lawsuits. The few that have, and actually where I worked, they had one. And it took years to go through the court system, but it was very successful. And they were awarded millions of dollars, which then gets split between the employees that had the courage to put their name on the class action. But most of them don't have the courage to do that because, again, retaliation. Management's going to see who put their name on it. And then there's going to be retaliation for putting your name on the lawsuit that you were 1,000% a victim of that alleged crime. You know?
Wow.
It's insane.
Wow. Why are nursing students taught theory and fantasy, but not real world chaos? You've said it's borderline criminal.
Yeah.
What kind of damage does that do to new nurses?
Oh, it's so damaging. Something like 40% of new nurses leave nursing, not just a job, nursing within the first year. After spending years and how much money to become a nurse and get that degree, up to 60% by the second year. Yeah, it's outrageous. And then they claim there's a nursing shortage. No, it's a shortage of nurses willing to work in the toxic conditions. They don't prepare nursing students for reality. They teach them theory. Theory is very important, nursing theory, very much so. But it's this perfect textbook world where A and B will equal C. And that just doesn't happen in reality. So they're thrown out there without knowing basic things like, you really need to have a copy of your Nurse Practice Act. You need to have that on you. You need to, which is basically the rule book for nurses in that state, what you can and can't do. You need to know that it's different state to state. So if you travel, if you're a travel nurse, you need to get familiar with that state. You need to know your individual state labor laws. You need to know if they can force you to work mandatory overtime or not. You need to have professional liability insurance. That's a big one. They lie to nurses and say, you don't need your own liability insurance because the hospital has it and you'll be under the hospital's policy. And while that's technically true, that's just not the way it plays out because that's their insurance policy. So, of course, it's going to default to protect the organization. And what they do is they throw the nurse under the bus and make them the scapegoat almost every time. And so then they can say, well, it was the nurse's fault. We got rid of them. So, we've washed our hands of it. We did our part. We got rid of the problem, right? So they need to be told things like that. You need your own professional liability insurance. You need to know your rights in your state. You need to be familiar with what the State Board of Nursing can and can't do. You need to have your nurse, like all these basic skills that every nurse needs to have and be intimately familiar with are almost never touched on in nursing programs. So they get out there completely oblivious to all of it. And then someone like me comes along and says, you need your own professional liability insurance. You need this, you need that. And they're like, what? No, I was told the employer has it. I don't need that. Why do you think? Why do you think they don't want you to have your own liability insurance? Is it maybe because then you'll have someone fighting for you and standing up for your interests and rights instead of the organizations? Yeah, of course it is.
You're letting the fox watch the hen house.
Yeah. They need to know about unions, that it's your right to unionize. It's never taught in nursing school, ever.
Wow. How many medical errors are linked to untreated nurse mental health? If the system scares nurses out of getting help, how does that impact patient safety?
Well, we do know that untreated mental health conditions in nurses does lead to medical errors, right? I mean, that's just common sense, right? If you suffer from something long enough and it's untreated and it's compounded every day in these horrible, toxic, unsafe working conditions, the inevitable result sometimes will be an unintentional error, right? That's just common sense. We do know that. So it's a patient safety issue. It really is. It's not even about nurses. It is, but it's about patients. So your loved ones, when you're in the hospital, may very well pay the price for nurses not being given the freedom to get the help they need.
Wow.
Yeah.
Yeah. What happens to a nurse who simply says, I'm not okay? What's the risk of being honest in today's healthcare system?
Reported to the Board of Nursing under the guise of, well, maybe they need help. Maybe we need to get them the help that they need. Or you report it to the manager because maybe you have genuine concern. But then the manager goes to the Board of Nursing or makes them go on some kind of monitoring thing or meet with them weekly, basically put them under a microscope, which isn't helping anyone. Or they say, we have an EAP counselor for the hospital, an employee assistance counselor. Well, they have one for hundreds and thousands of employees, and you can barely get an appointment with them. But they'll say like, well, we did our part. We offered you resources. Oh, you mean Kenny? Kenny down on the first floor whose next available appointment is November 5th?
2027?
Yeah.
It's almost like the healthcare administration system is set up to make nurses vulnerable to the point of self-harm.
Yes.
And then when those nurses reach out for help or try to get things changed for the betterment of them and for the betterment ultimately of the patients, that is weaponized against them.
100%. Yes. We are set up for failure. From day one, we are set up for failure.
Has it always been this way? Has healthcare always been this way as far back as you can remember?
Yeah, it has. I mean, I have been in nursing now for close to 30 years, first as a nursing assistant and then as a registered nurse. This has been my experience from day one. Yeah. Now, did things get even worse with COVID? Yes. And unfortunately, it has not gone back down. But this has always been the case.
Speaking of COVID.
Yeah.
What do you think of The Pit?
Oh, it's such a good show. I've seen every episode. I'm obsessed.
I'm a Noah Wiley guy.
Yeah,
like from
me
ER,
too.
Right?
ER. I love it. Full circle.
I'm not a show guy, but I was like, okay, I'll give it a shot. And I was like, go HBO.
Right.
Like, oh my God.
Yeah.
And it's
very realistic.
I was going to say, how realistic was it?
I would say it's the most realistic medical show that I've ever seen. They clearly, not only are the little details being addressed, so like the right equipment, the right placement of whatever, clearly they have medical staff on set that is directing all of that, but they are tackling some of these really big issues like violence in hospitals, the nursing shortage, they're addressing those.
The admin coming down.
Yeah, I think in the first episode,
chirping.
They did that. It was amazing. Yeah, I have one criticism for the show, and it's that there's not a lot of nurses, and it's a doctor focused, physician focused show, so that makes sense. But a lot of the procedures that you see them doing would actually be done by a nurse.
Really?
Yeah, but the accuracy otherwise on point.
Is on.
Yeah.
It was one of the clips I saw and it was Noah Wiley saying their approach was unlike any other medical show.
Yeah.
ER, St. Elsewhere, like Grey's Anatomy. I think Grey's Anatomy is still on for fucking 75 seasons.
Like 27 seasons or something. Yeah.
That was always from the purview of the patient.
Yeah.
A lot of times is what it was. Where this is more the purview of the healthcare provider, the nurse, the doctor.
Yes.
It's how an ER is actually run. And that's why I think after watching that, and I've just heard that to be a nurse, you really don't, ER is not your first choice. It might be your first choice in the beginning for the first year or so.
There's a lot of nurses that gravitate towards ER that absolutely, I am not one of them.
Okay.
But a lot of nurses thrive in that environment. The adrenaline rush, the total variety, never knowing what you're going to get.
That makes sense. Yeah. it's just I forgot. I wanted to ask you about that because I love the show.
Yeah,
love
it's
it.
so good. Well, my son actually just texted me yesterday, and he's not in the medical world at all. And he started watching it. And I think he got to episode 3 and he said, I can't watch it anymore. It's too sad.
Oh.
And I said, it's reality. He said, people are dying. They are dying.
People are dying.
They are dying.
Like how they handled a mass casualty event.
Yeah.
Was bananas. Because then I'm thinking, I go back to when we had October 1.
I was there working at the level 1 trauma center when that happened.
So you're at UMC.
Yep. I was.
Yeah, I had my most watched YouTube clip is a friend of mine, Phil Ulrich, and shout out to Phil. He was shot multiple times.
Yeah.
And so we put together police body cam footage of at that time his girlfriend. Now they're married and they have kids. Her getting the one guy to go off reservation. Please, my husband needs help. And they packed a bunch of people in the back of his car, and they were going to go to Centennial. And then either Phil or one of them said, "No, we need to go to UMC."
Yeah.
And so he's going 100 down the strip, getting to UMC, and it was medically induced coma. He was in for 2 weeks.
Yeah.
Wild. And the wildest part, the clip that got the most views was Phil ended up reconnecting with the Metro officer that saved his life.
Oh, awesome.
That got him to UMC.
Yeah.
And he says, I own a mortgage company in town. What can I do? Can I get you a free mortgage? What do you need?
Yeah.
He pulls out, he goes, well, we're actually looking for a house now. Pulls out a pre-approval letter from First Option Mortgage signed by Philip Ulrich, president.
That's amazing.
So it was just, and they're friends to this day.
I love that.
And so, but it was, even though we have horrific healthcare here in Vegas, UMC is a really good facility.
It's great for trauma.
Am I wrong in saying that at the trauma level?
If I or a loved one was a victim of a trauma, I would want to go to UMC. That is all I will say.
Well said. Well said, my love. Moving on. And this segues great into our next question. What's the cost of silence? It's right here, question 13. Both for nurses and the patients they're trying to protect. Why do so many nurses keep their heads down, and what happens when they finally can't?
It's that fear of retaliation again. The general apathy amongst nurses is off the charts. Very apathetic in nature. And that's a generalization. Nurses get mad at me when I say that. But unfortunately, it's true. Not for everyone, but it's true. A lot of nurses lack courage. And we pay the price because we don't stand up and we stay silent. We pay the price. Our careers pay the price. And ultimately, patients pay the price. It's a patient safety issue.
It's crazy.
It is.
It's crazy. Last question. What do you want every person watching or listening to this to do right now to help? Give us action. Give us the action step. Who do we call, email, tag, pressure?
Well, if you're here in Nevada, the SB 182 that we mentioned earlier, there are 3 key pieces of federal legislation. I think I mentioned it last time I was here. It's the Safe Staffing Act. It has a long actual name. That's a nickname. It's like Nurse Patient Safety Quality of Care Act, something. I've got them all on my website on nurseerica.com if you want to look. There is the Workplace Violence Act and then the PRO Act, which would make it substantially easier to unionize for anyone, not just nurses. So these 3 pieces of legislation would be game changers for the whole healthcare sector. If you can pressure your representatives, your legislators to support this, and you can't just send that one email, you've got to keep on them every week, resend it, make an appointment. You can go and meet with your representative, at them on social media. That gets their attention. Send the snail mail, but keep doing it. And you end every single communication with, if you fail to support this bill, this legislation, myself and my family will not support you in all future election campaigns, because that's what they care about.
That's great.
Yeah.
That's great. I don't do like, where can everybody find you? Like you're going to be tagged on everything. We collab on everything already.
Yeah.
Thank you for coming in.
Thank you.
I admire you. I love your brain. I love you as a person. You're just your heart's in the right place. And I know that you are sometimes fighting or all the time fighting overwhelming adversity, but I'm a fan, man. The Fargos are fans of you and of what you're doing. And the door is always open for you to step in here. And if there's something that is really getting at you and schedules align, let's get you in here and let's talk about it. Right?
You know where to find me.
I can't thank you enough for doing what you do. And I'm not even in the healthcare field, but the person I love
vicariously you are.
Well, the person I love more than anything in the entire world. I mean, it's the only thing better than being married to a nurse is looking at a nurse's ass in purple jegs is the greatest thing ever.
The best.
She's going to be like, he's an asshole for saying that, but it's the truth. Or black is good, but purple's my favorite on her. And so I love that the best. So thank you for getting rid of all the old uniforms and all that stuff. And now at least like somewhat.
You like the joggers.
Those are with the cuffs on the bottom.
Yeah.
Oh, hell yeah.
Cute.
Hell yeah.
A little bit of ankle showing.
Little bit of ankle. I'm not even a foot guy, but ankle? Oh, hell yeah. Done. Thank you, my love.
You're welcome.
Very
My
much.
pleasure.